At the moment, I think we're using genomic technologies in a targeted fashion, and particularly in 3 or 4 types of cancer. So in lung cancer, in melanoma, and in colorectal cancer, it's actually mandatory to do genomic testing. That's likely to be the case in some breast cancers and ovarian cancers within a very short time. Arguably, in some places it is already. It's increasingly essential that the multidisciplinary management team that looks after a patient talks to each other about the genomic data as much as they do the radiological or other data from that patient. And we're increasingly seeing that multidisciplinary teams work together to look at the data, to decide what the best management structure for that patient is, and to decide on the treatments they need. It's important to make sure that any genomic technologies you use for a patient are done safely, that the result obtained is the result for that patient and that it's the correct result. And that means that it should be done within fully accredited ISO 15189 laboratories. And those laboratories, when they put a new technology into practice, will ensure that it is safe by doing some internal verification of the technology, and then they will make sure that they are participating in an external quality assurance scheme. Initially, we were using polymerase chain reaction, PCR, to look at a very small number of variants within genes, a number of mutations that were present. We're now changing to look at more mutations in more genes, and although polymerase chain reaction is still being used and we're able to multiplex some of those assays and therefore produce panels, we are actually going a little further now and using next-gen sequencing technologies, and those are definitely coming up, and the bigger laboratories that are capable of using them are doing that. It's worth saying perhaps that next-generation sequencing is not simple, it's time-consuming, it's expensive, it's difficult to interpret, and things can and do go wrong. So within the clinical environment, it's very important that next-generation sequencing is very carefully controlled. I think we're going to see molecular pathology expand to all tumour types. I think within a few years it will not be acceptable to report a tumour without doing the molecular pathology on it at the same time, without knowing what the driver mutations are, without knowing what its mutational landscape. I think the future of molecular pathology is very bright. We have a number of new technologies coming in, particularly next-generation sequencing, and that will become increasingly automated and easy to use for patients. So it will become safer, less expensive, and more able to be used in a large number of patients. I think we're also going to see that these technologies are used across all cancers, not just some of them. And that as we gain experience, as oncologists gain experience with the drugs, we will see the pathologists helping them by making sure that they have the data they need on each patient.